Okay. Well, thank you all for joining us for our quarterly Go NAPSACC TA call. My name is Kiara Jones, and I am a program manager here at IPHI, and I'll be your co-facilitator for today. So as I welcome you all in, I just want to first off start with some introductions. So if you can in the chat, please just state your name, your pronouns if you feel comfortable, your title and your organization that you're with. And then if you are currently enrolled with Go NAPSAC or like what your current role is, and if you could just start putting those in the chat, that would be great so we can kind of have an idea of who's all here. And while you're doing that, I'm going to just pass it to my couple of my colleagues that are also on today's call. So I'm going to go ahead and first start off with Sarah.
Hi, everyone. Nice to see so many of you here and many of the names I know. Sarah Flores, she, her pronouns, a program director here at IPHI, and I'm managing the SPAN grant program that this network is a part of. Trevor?
Hello, everybody. My name is Trevor Johnson. I'm the Nutrition Initiatives Program Manager for Illinois Public Health Institute, and I use he, they pronouns.
Thanks, Trevor. And I'm not sure, I can't see my screen. Is Jasmine on the call yet?
Yes, I'm here. Hi, my name is Jasmine Natividad. I use she, her, hers pronouns. I am a public health AmeriCorps service member with IPHI, and it's a pleasure to meet you all.
Thank you. Thank you all. And thank you for everyone that is putting your intro in the chat. I appreciate that. And it's good to see who's all here. All right, so just to get started, I'm just going to run through a brief overview of what we'll be discussing today. So we just went through our welcome and introductions. Next, I'm going to briefly go through just some short group norms. Then we'll be going into an evaluation findings video and discussion. And then we'll have some also a presentation on focus group findings from a recent ECE focus group. And then we'll have some additional group discussion. And really a big part of this call is we want to take the feedback that we received from you all a couple months ago at our last quarterly meeting and really just trying to dig more into what we heard and how we can better support you all, and also how do we maximize these calls in the future. And then we'll finish up with just giving some resources and answering any questions that you may have. So quickly, I'm just going to go into a few group norms. So during this call, we just want you to take space and make space. So please feel free to take yourself off of mute and raise your hand if you have questions or type in the chat. And also, if others are trying to speak, please make sure you make space for them as well. We ask that you try to be as present as possible. We understand this is the afternoon meeting and you all have probably had lunch by now. But we do have just a short time with y'all today. So we just ask for you to try to be as present as possible during this meeting. Make sure to if you have any questions, please don't hesitate to ask either myself or my team that will be monitoring the chat box to be able to answer any questions. And then we finally just ask that you listen with openness to any new ideas or thoughts, perspectives that others may have without having any judgment. So we all come from different walks of life and we might have different input opinions. So we just ask that those all be respected. Aside from that, just want to make sure all those group norms, those sound okay for everyone. And if you have any other norms that you feel like should be added, please don't hesitate you can add those to the chat, or if you want to come off of mute now and add anything to that, I'm happy to hear. Okay, well, hearing nothing, I'm assuming that everybody's okay with those group norms. So now we're going to go ahead and get right into the next part of, Paula. I heard come off of mute. Did you need to add anything, Paula? Okay. Well, if you need anything, please don't hesitate to reach out or add into the chat. Okay. Thanks so much. So this next session, we're just going to be getting into some ECE evaluation findings. This next section, it's basically going to be over some findings that we had. This is going to be a video presentation actually that was recorded And this presentation was presented by Dr. Jamie Shrikri, which is from University of Chicago, Institute for Health Research and Policy. In the video presentation, Dr. Shrikri will share her findings from the ECE statewide survey, which was conducted during the last round of SPAN. This survey basically provided critical insights into how the COVID-19 pandemic has impacted nutrition and physical activity practices at ECE sites across Illinois. In addition to that, her findings were also recently published in July of 2024 in the issue of Journal of Public Health Management and Practice in an article titled Change in Nutrition, Physical Activity Practices in Early Childcare and Education Settings in Illinois during the COVID-19 pandemic. Long name, but you don't have to remember that. I will be sharing this article as well as other resources after this meeting in a future email. So you don't have to worry about remembering all that. So with that being said, I'm going to go ahead and click onto the video that we'll be watching. And after the video, we'll just do a quick touch base to see what your thoughts are. Right, and I'm going to hit play.
In the chat. Okay, you should be able to see that okay, Sarah?
Yes.
Okay, super. Well, thanks everyone. I also want to call out our colleague Rebecca Schirnbach, who is on the phone, who is also involved with the study and actually was the lead author on that paper, and Jimmy Lin, who actually, Julian, we didn't update this. He actually has his PhD now. So let me advance. It's not advancing for me. There we go. So we're going to go through sort of the overarching study questions and then briefly tell you how we did it, but really focus on the findings from the study. We studied, as Sarah indicated, changes statewide from pre-pandemic to post, or 2022, 2023-ish in ECE nutrition practices and physical activity practices. And then some implications for you as you all think about your policy strategies and other advocacy and TA needs. So we really had a couple of key questions. We wanted to know overall across the state, how did nutrition and physical activity practices change? Did they vary by program type, so centers versus homes? Did they vary based on whether they were CACFP providers or Head Start providers? And specifically for PA, did they vary if they were Head Start providers? So we were really lucky. We did not actually anticipate obviously having a pandemic, but we happened to have sent out a survey statewide in December of 2019 as part of the iSpan grant to all of INCRA's statewide list of ECE centers and family and group daycare homes. So we managed to get baseline data. We thought we were getting baseline data leading into changes to 406 and 408 regulations, but little did we know the regs wouldn't get updated, but we have a pandemic. And so we were in this unique place to actually know what the situation looked like prior to the pandemic. So we did data collection. We had about nearly 1,000 responses. We ended up with about 888 that we were able to use in the analysis. We did a follow-up survey in October of 22, so towards the end of the prior SPAN grant. And there we had more, it went out through a different process, but we had a little over 1,000 responses on that one. It's basically, it wasn't a longitudinal panel, so it wasn't necessarily the same providers from 2019 to 2022. It's looking at cross-sectional changes over time in the state in terms of these practices. And we looked at 14 nutrition-related measures, 9 physical activity-related measures. They were defined by Go NAPSACC, the Caring for Our Children framework, and CACFP as well. We analyzed all the data looking at a variety of different site-level characteristics, as well as zip code level characteristics related to zip code level SES and race and ethnicity, as well as zip code level rurality of where the provider was located. And we did a variety of different analytic techniques to be able to look at change over time. So what did we find? First of all, this is what our sample looked like. The first column is going to be your baseline, so the 2019 data, and the second column is for your follow-up in 2022, just so you can see the differences in providers. And as you can see in the follow-up, we had a lot more centers than we did have homes, but we were able to adjust for that. So we were okay with that. For the most part, in the prior sample, we primarily had sites that served all ages of children, and in the follow-up survey we had a split. And we also had differences over time in terms of weekly fee payment sources. CACFP was more focused in the first baseline than in the second survey, and our Head Start was pretty comparable over time. Our number of staff in the follow-up was a little bit higher than it was at the baseline, and our enrollment capacity was larger because we had more centers than we had homes in the follow-up survey. And then in terms of our racial and ethnic distribution at the zip code level, that was pretty comparable over time, as was the zip code level median household income, population size, and rurality. So the zip code level characteristics were fairly comparable. It was just in terms of the nature of the providers participating over time that were somewhat varied. So first, we're going to talk about changes in meeting nutrition-related best practices from 2019 to 2022. The green bars are the so 2019, and the blue bars are in 2022. And the items that have asterisks next to them mean that we had a statistically significant change over time. In most cases, it was a statistically significant reduction in the practice over time. Just so you know, all these data that we're presenting were adjusted for all the characteristics on that prior table that we shared with you, which is why we weren't as concerned about the differences in the provider characteristics at the 2 time points, because we've controlled for all these factors. So as you can see, and I think IPHI wanted me to spotlight things that were positives. And so the positives are we didn't see statistically significant changes in terms of the availability of breastfeeding space, having breastfeeding locations, having dark green, red, orange, and yellow vegetables, drinking water always being available, as well as serving 100% juice less than or equal to 1 time a day for 2 to 5-year-olds, responsive feeding practices, authoritative feeding style, and offering local foods more than 1 time a week. Those stayed pretty consistent over time. The places that we actually saw changes, and this is actually in a good way as well, is we saw a reduction, this is not a good thing. We saw a reduction in the proportion of sites that said that they were offering fried or pre-fried potatoes or meats less than 1 time a week. So a reduction here means that they were offering it more than 1 time a week rather than less than 1 time a week. So that's a negative. We saw a reduction in not offering sugary drinks. So again, a blue here, the reduction basically means that they're offering more sugary drinks than they were at baseline. And the same with sugary cereals. They were offering more sugary cereals. So the use of or offering of fried foods as well as sugary drinks and sugary cereals tended to be more prevalent in 2022 than it was at baseline. When we looked at differences between center and homes, we saw that centers were less likely to meet nutrition-related practices than homes from pre to post. Within those categories, the centers in particular saw the greatest decline in the best practices. So again, same with the prior slide that I showed you, more fried foods being offered, more sugary drinks and sugary cereals being offered, and they were less likely to have authoritative feeding style. And however, they were more likely to offer local foods more than 1 time a week at the center level. For homes, the only significant difference we saw over time was offering more fried meats over time. So that's probably like fried chicken tenders or something like that. We saw that CACFP programs experienced more changes or were less likely to meet the nutrition-related best practices than the non-CACFP programs. And the results are very consistent with the prior slide that I showed you of center versus home. CACFP programs, which tend to be centers, saw the same exact patterns that we saw in the prior slide. Although we did see increased use of food to calm or encourage children at post than we did at pre. And we really didn't see much of a difference over time in non-CACFP, with the exception of probably offering French fries. Head Start also saw significant declines and less likely to meet best practices than non-Head Start programs. And again, the patterns were very comparable. It was on fried foods, sugary drinks, and sugary cereals, authoritative feeding style, and using food to calm children. Those things were all more prevalent at post than they were at pre. And so basically what it means is they were, offering more fried foods, more sugary drinks, more sugary cereals, and not using authoritative feeding style and using food to calm children more than they were at baseline. And for non-Head Start programs, again, the only difference was in fried French fries. In terms of physical activity related best practices, those changes stayed pretty comparable over time. We really didn't see a lot of difference from pre to post, with the exception of toddlers being seated. The best practices, toddlers being seated less than 15 minutes at a time, and sites were less likely to report meeting that best practice, which meant the toddlers were probably being seated for more than 15 minutes at a time. And when we looked at that in terms of centers versus homes, again, we saw, just like nutrition, centers were less likely to meet the physical activity related best practices over time than homes were. The one exception that we saw, or two exceptions that we saw in the homes related to screen time, homes were more likely to report in a good way no screen time for children at 2022 as compared to 2019. And they were also more likely to report less than 30 minutes of screen time for 2 to 5-year-olds. So that's a positive change that we saw for homes. Whereas for centers, things went in a negative direction. They were more likely to not meet the no screen time best practice. They offered more screen time. And they also were having students or children seated more at a time than they were pre-pandemic. And then Head Start programs, just like CACFP with the nutrition, Head Start programs were also less likely to meet the physical activity related best practices. And our theory on this is that Head Start and CACFP programs are more likely to be centers. And centers are where we saw the greatest change over time in their practices. They're more likely to be closed than the homes were. And so they're the ones that had the most regression over time than the non-Head Start programs. So just briefly on some implications, we saw declines over time in meeting nutrition, physical activity related best practices, particularly pronounced for center, CACFP sites, and Head Start sites. We really view these findings as a new baseline for the state, as, if we do get the revised regs for 406 and 408, but regardless of the revised regulations, this is the new starting point for where we are with the ECE and the state. Through the ISPAN funding for this next round, we are going to do 2 more rounds of this survey. We're going to do one next year and one probably in 2 years after that, just so we can continue to monitor if there's been positive improvements coming out of the pandemic in the state over the next couple of years. So with that, I'm going to pause. I don't know, Jillian or Rebecca, if there were any questions in the chat at all.
All right. Awesome. So I hope y'all enjoyed that video, and I hope that it also kind of give you a little bit more to think on about the different changes that have occurred since the pandemic. And so to just kind of kick off a little brief discussion on what you heard in the video from Dr. Shuki, I want to start off with questions regarding nutrition best practices. And in the presentation, were there any changes that really stood out to anyone regarding, offering more fried foods and potatoes, or offering more sugary drinks and cereals? Was there anything that stood out to you the most in that video? And you're welcome to take yourself off of mute if you want, or you can add any comments in the chat.
So it took me a bit of learning, pardon me, this is Trevor from IPHI. Um, uh, Learning what an authoritative feeding style is. I'm just going to read a definition of parenting style that involves caregivers encouraging children to eat in a supportive way. And I think this is a really excellent highlight because by centering relationships and incremental growth, though the food offerings may not be ideal, we can help encourage healthier choices through that particular feeding style. And I like that. I like that aspect.
Thanks, Trevor. And can you repeat the word of the name of that that
Yeah,
stance?
this is uh, when they talked about the authoritative feeding style
Or take the
that
yes.
that we're saying. This is a style that involves caregivers encouraging children to eat in a supportive way, characterized by structured guidance that considers children's feelings and preferences while still maintaining boundaries and rules.
Yeah. Thank you, Trevor. I appreciate that. Does anybody resonate with that? With what you heard? Do you feel like you agree with that change, could have happened? Do you feel like that was, you maybe perceived that in a different way? Any thoughts to those changes as far as like I said, just offering more like those sugary drinks and foods and fried foods? Anything that you resonate with other than that? Okay. Well, I'm gonna I'll let because I know some of y'all like to, have to think that through and take it's a lot to take in. But please, as you're going, please make sure that you can just drop anything in the chat at any time if you have some input to add to that. We'd love to hear your thoughts on that. So, kind of adding to that, so, we were talking about nutrition, but there was also a lot of changes in physical activity. Was there anything that stood out to any of y'all regarding the physical activity changes? So, daycares, some of the things were mentioned were like daycares offering more screen time, and children being seated more. Did any of those changes any other changes stand out to you regarding physical activity practices? And when we think about that too, I just want to add to, so like comparing now, that I would say the world has opened up a little bit more. Things are not so constrained as far as what the limitations are of our ECE facilities. Um, that's the when I think about those really those pivotal moments during that difficult time, that we had to really have to work through and to make those adjustments to keep these daycare centers open or to have children around. So you know it looks like there was a lot of people had to kind of make that change and that pivot based off of that from what the responses were in that survey. So just wanted to just open it up for anybody to add to that, or if you have any thoughts of how you feel like, how that might change today, or if you think that those results have changed as of today, now that we're kind of out of the deepness of the pandemic. Anyone have anything to add about what stood out the most to you for either the nutrition or physical activity practices?
Yeah, good afternoon, everyone. Kiara, this is Chisom Okoli. So I am from the ECE team at CDC. I am, sorry, and I'm an implementation fellow. So first of all, I want to commend you guys. I came across this paper sometime earlier this year, and it was very fascinating to see that you guys are really like, trying to monitor how the best practices are still being held within the ECE programs. So my third or my question would be like, what measures are you guys thinking of putting in place to kind of address the declines that we saw in some of the best practices, especially around sugary beverages, sugary cereals, and the decline in serving less fried potatoes across EC centers and CACFP participating programs.
Thank you. And thank you for making a point in that the state as a whole has really tried to keep on track with a lot of the ECE policies that it holds in place. And that they're also acknowledging, and thank you, Mitchell in the chat just said, glad that you're acknowledging that the follow-up findings are the new baseline. I think that whenever you have any type of big change, and in this case, it was a huge change with the pandemic. I think that it's important to really try to go back to the baseline of why we're doing that work. Are these policies in place from the get-go to these? Why do we have nutrition best practices and physical activity best practices? And when we come down, and I mean, in just simple terms, we're doing it for the children and also for the betterment and to have a baseline for these ECE providers to have for their children and to be able to have, healthy, nutritious foods for the children, to have physical activity. As we know, in some families and households, they may not have access to fresh, fruits or vegetables, or they may not be, getting their full breakfast or meals. And sometimes these daycare and childcare facilities are the only places where they're getting that. So thank you for acknowledging that. And remind me, did you have a question at the end of that? I apologize if I didn't answer that.
Yes, the question was, are there like measures in place to kind of address the decline? Are there ways that you guys are thinking of tackling that, so that probably maybe eventually in the follow-up survey, probably there could be like a positive change, in the right direction. So
If you want,
especially around the sugary beverages, the sugary cereals, and the fried potatoes or the fries. Yeah.
yeah. I'm
Sarah,
so glad you mentioned that, Kira. If it sounds good, I think I could weigh in a little bit on
absolutely.
this. Yeah, great question. Wanted to let you know, as you may all recall, I mentioned that this network is part of a CDC-funded grant, the State Physical Activity and Nutrition Program. So I'll repeat that. The State Physical Activity and Nutrition Program, ISPAN, a 5-year program. And I know a lot of you on this call were here with the network before. So we've been convening this network for the last 5 years. We are now in year 1 of another 5. So we'll end up having 10 years of CDC funding to our state to address ECE work. So with measures, I want to let you know, we are going to do another 2 of these statewide surveys in our new project period. We're slated to do the next one next year. We are thinking strategically and having conversations right now about when is the best time to do those surveys. Because, as of next year, it could be another opportunity to do another scan. It'll be similar to this, but so we have a better understanding of where providers are at now. And part of the reason why we're doing the statewide survey, or the reason, is understanding where folks are at on best practice implementation, because our whole goal of SPAN is to put in statewide systems and supports to help providers move toward that best practice implementation and meeting them where they're at. So one thing we're doing, Chisholm, is with this network, we're about to talk to you in a minute about some focus groups we've been doing, because year one, we are assessing our landscape once again. Where are we at? That's why these findings are so crucial, because we're understanding where were we at immediately coming out of the acute pandemic period. We'll do our survey to get another refresher. Where are we at now? And then we're going to continue convening this network. The TAs on this call, you all are working with providers. So we want to get your feedback. We want to dig in a little bit more later in the call so we can figure out how do we help you help providers meeting them where they're at. And I also just wanted to mention that we are definitely looking ahead because in our state, we're undergoing a large transition around ECE. They're making a new state agency dedicated solely to ECE. We might be having licensing standards updates coming out. So we'll have opportunities that we can latch onto. And we did a lot of training and like professional development with our partners INCRA on this call, where we created different trainings and things, like one around intro to CACFP, one around physical activity outdoor time, that we really think we'll be able to leverage and continue to push out, especially in connection with any of these kind of policy and licensing standard updates that might happen. So more of like measurements and then supports to respond to what the measurements are telling us. That's my 2 cents.
Thank you very much, Sarah. You really I really captured everything that you said. And I also want to commend you guys, like the partnership between you guys and the academic, the faculty. I think that's a very strong partnership, right? And that's place for continuity, in monitoring these best practices. Then finally, I'll probably just chime in that, something else you guys could also think about, like strategies that you could use to kind of address the decline, maybe social marketing around maybe sugary beverages, or probably micro trainings. If you guys get to convene EC providers together, or maybe, doing that through email, just to remind them that, this is important, not just to the children, but also to them, just because consuming foods with high added sugars doesn't benefit the body in a good way. But thank you.
So glad that you noted that, because yeah, just what you said, responding to specific things in the survey, you've identified a need. If others agree, feel free to let us know if you have other ideas on things like that. Like, yes, so you messaging around sugary beverage consumption and ways to support centers and homes in reducing that is something you all could use to help work with providers. I also want to mention, the Go NAPSACC assessment tool provides us measures, provides us assessment information about what sites are doing. So of course, we're examining that too along the way to just get a better understanding of where folks are at and what do they need.
Thank you, Sarah. And thank you, Chisholm, for bringing up just some great, great points. And with that being said, I do want to kind of shift gears, but also kind of stay in a similar realm of that. So one thing I'm really excited to share with you all is we actually participated, and by we, IPHI worked with the University of Illinois evaluation team to present a couple of ECE focus groups for parents and also providers of ECE. So over back in July, I want to say that was when we had the first round. We did a couple focus groups where we asked for daycare and Head Start providers and also family group home providers and their parents to come join us for a focus group so we can get their input in on some different practices and the challenges that they experience when sending their child to daycare. So I just wanted to quickly take this time just to go over some of that feedback that we received from those focus groups because I felt like it was very eye-opening to me to hear those perspectives of what was discussed. So all of these slides were prepared by EC evaluator Rebecca Shermick. So I'm going to share those, just a few of those with you right now, just to give you some feedback of what we heard. So one of the first focus groups we did was for the family and group home providers, and we asked them about their positive experiences. We wanted to know what are some positive things that they currently were doing that help support nutrition and physical activity and screen time in their facility. And so one of the things with nutrition is they said following the ACD programs that or just food programs in general, following those guidelines helps to make sure that they're feeding them the required components every single day. And also, a couple of folks actually mentioned that they do have gardens at whether they're at their daycare facility or actually mostly the family group home, I should say. They have gardens and they allowed the children to participate in picking fresh fruits and veggies, and that really helps them have interest in actually eating the options instead of just putting it in front of them. Physical activity, there was a lot of great um, feedback on having a large amount of space outdoors, having different equipment where they can stay active, and really to find different activities to keep them engaged and interest. And as far as screen time goes, a lot of at-home providers actually really kind of try to shy away from screen time. They try to promote play and outdoor physical activity as much as possible. So those are just a few of the different highlights from the positive experiences. And then these are just, I'm not going to go through all of these, but these are just a few best practices and support needed and also challenges that they face. So some of the things that they were talking about as far as what support they may need was needing more funding, more money to help implement these best practices. Some even mentioned possibly hiring on an assistant at the at-home facility to help prepare with meals and things like of that sort. As far as challenges go, children sometimes aren't, like I said, not being fond of vegetables. It's difficult getting kids to try new foods. So again, trying to think of ways that can keep the kids as involved as possible, but while still meeting those requirements is for their food and nutrition. Physical activity, again, I already kind of touched on that, but having adequate space to play is really crucial for having a great active facility for the children, and taking kids on field trips, getting them away, getting them out, getting, so they can explore and see things, but also keeping them active at the same time. And as far as challenges of that, sometimes again, keeping the kids can get bored when there's inclement weather, whether it be cold or rain or too hot. A lot of times you have to take those activities indoors, and there just may not be enough space for the amount of children that they have. And then these as well, I'm just gonna, like I said, just go through very quickly. This is from our focus group from the daycare and Head Start providers. So they had a lot of different great input on cooking practices and preparation of snacks, having the kids involved with the meal planning, having participation in ECE, like childhood programs like SNAP Ed, and really having like more education during mealtime as well to get kids understand why they're eating these type of foods. For physical activity, again, if they're using screens, they try to avoid screen time, but if they are using screens, they try to do it in a way that's going to promote physical activity. So if they're showing them videos of like dancing videos, they have different sites now on YouTube. I know there's like Miss Rachel and I forgot the other ones, like Rachel's Corner and or Gracie's Corner, I think that's the other one. So they try to use screen time in a positive way, and just really giving them time to get outside and move and have play. And then I'm just going to kind of skip past this because we kind of already touched on this even at the at-home facility. But they try to avoid you know uh, really giving too many. They don't try to force like picky eaters to eat things, but they will offer those items to the kids. But that is a challenge for some kids that have allergies or intolerances, and really just unhealthy they habits where they just like that one certain type of food and they don't want anything else. So those were just a few of the best practices. I'm gonna move along here. This is just, again, just reiterating some of the physical activities that they felt like was helpful for them, was having large areas, an empty classroom, lots of different toys to keep different types of children engaged. And as far as the challenges go, again, we're going back to space. That was a very common thing, not having enough indoor space, having concerns from the parents regarding different physical activities they may or may not want their children to participate in. And also just some stated that some of the children just simply do not come to school appropriately dressed to be able to go outside. And then I think that might, and yeah, that's the last one of those surveys. So just wanted to share some of that feedback with you. And with that being said, I'm going to go ahead and pass it along to Sarah to talk about some post-pandemic items. So Sarah, go ahead and take it away.
Thank you. So, a breath to take it all in. And you've heard about the evaluation findings. Now you've heard about the focus groups. Our question to you is, now that you've seen all this, we're wondering how we can support you in TA that you're doing with this moment in time where we're at. So Chisom had said some social media messaging around sugary drink reduction. Does this bring anything up for you on supports or materials or resources that you could use to help meet providers where they're at and move them toward that best practice implementation in your TA work? And I'm wondering if folks are actively doing TA at this time as well.
I'll say for us, I work with Mitchell, who's also on the call. We have our first assessment scheduled post-pandemic. I had used like the paper version prior to COVID, and so we're just like right on the brink of starting that process within our area, in our unit.
Okay, great. And I'm looking, can you remind me which area you're working in?
Yeah, so it's for Project Now Head Start. We're located in Rock Island County, and I believe their service area is Rock Island and Henry County.
We have tried, but to do the Go NAPSACC again has been met with, not open arms, I guess. I think we've had a few people dabble with it pre-COVID, right after COVID, but haven't really used it. I will say the Head Start now is looking at doing what's called just hold it up so I remember, the Staff Wellness Action Plan. And I'm just learning a little bit about that and what that's going to entail. And that looks like it's a lot of listening sessions and some focus groups and some motivational interviews on how the overall wellness of the center will be. But I tried even last August. I did a presentation to about 24 providers, and people seemed interested. I sent them the link and tried to follow up, and I have not had good success. So I was hoping to get on the call to see how other people are doing it and try to glean some nuggets of good information. So thank you.
Great. Well, I'd love to open the floor to see if others have.
And then I'll say, for me, my focus is more so breastfeeding now, but even still, when reaching out to organizations and partners, when we say meeting them where they're at, they're not even ready to have the conversation about Go NAPSAC because they're focused on other things and getting the building up to code and small things that this is not a priority for them.
Yeah, I hear you. And Dale, is there anything further you can say about what you think is it the do you have any other sense of what the resistance is? Is it the same of what Dominique said, or you do just not know? You're just not hearing anything back?
I think with the Head Start, I have worked with them and we've tried it a couple of times. I think it's just very overwhelming for them. And even though if I try to get them just to do a section at a time, they have three different centers and they only wanted to do one assessment. They didn't want to do it at the centers. So I don't know, as I work more with the centers this next year, maybe I can then, they've had some changes in staff and stuff. So I'm still open to it because I think it's a good, they have resources there for them. You can help them navigate some things that they're looking at improving. Um, so that's my only thing. And I belong to a coalition and I've brought this up too. I don't know. It could be just my area. I'm up in Lake and McHenry counties. I'm not sure. And I know that I have program coordinators, Lee's on the call. They too have tried to get the centers to try to look at it. I'm just not sure if it's too overwhelmed. I think what it is if we could sit and do it with them together, we'd have better success. So when I did the paper version, I had good success. When we went to the electronic and we gave it to them to kind of do at their leisure and stuff, that's when I've been running into the problems. I don't know if that helps.
That does help.
Okay.
I'd love definitely to open it to the floor. And Richard, we have Richard here from UNC. I'm wondering if you've heard anything on the overwhelming piece, the folks being, just consumed with other things and how to appeal with things in the tool belt to appeal to ECE programs that are coming from that place. So definitely invite Richard to speak up if you have any wisdom from your end of it. He runs this for us. Or if others have words of wisdom or similar experiences you'd like to talk about.
I have a question, and hopefully he can maybe answer this. Can we both get a link to the same site? So as a TA, be able to work with them instead of them doing it and then us going behind it? Is there a way to help market? I don't know. Maybe it's been a while since I've played with it. So it might have even changed a little.
Yeah, these are all good questions, and definitely they're common questions and concerns. I think again, the capacity of an early care and education program now, especially now, is just, they're overwhelmed. So for them to be able to prioritize certain things that mean, like codes and regulations and licensing, I mean, some of these things come before health stuff. So you just have to understand the capacity, I think, is the first thing. Two, kind of understand their needs and wants. So kind of think about really what would get them interested in this. Is there something that they're working on that they really are doing well in or need help in? Is it breastfeeding that's really their focus? So thinking about that is another thing. I think again, like you said, technology is always going to be overwhelming for a lot of people. So yeah, oh my goodness, I got to register for something, then I got to sign in, then I got to go in and look at all these different tabs with all these different modules. So yes, working directly with a program is helpful, but that's based on your capacity as a TA as well and how many programs you work. The best way to do that if you want to work on their same account is to have them share their login and password information with you. And then you could bring it up during a Zoom call, and then you could show them how to do this and even help them through those steps. It's very similar to using the paper. You could go in for site visits if you have the opportunity to work, one-on-one with folks and actually have them do the paper copy, discuss it, and then you could enter that into their account for them if that was a barrier. So I think it's really, again, figuring out their capacity and where they are and figuring out what you can do as a TA to support them. I mean, the good thing with going through the system is then you have the data. You have the information about where they are now, and then the things that you do between now and the next time they do some work in Go NAPSACC, you can see that change because of your whatever your TA efforts are. But again, asking those questions, because even when I hear a lot of this stuff, it's overwhelming to do all, or it's overwhelming. So what's overwhelming? Like, digging deeper into well, what's overwhelming? Is it the technology that's overwhelming? Is it you don't have the time? Is that an overwhelming thing? And then beginning to ask those questions to dig deeper, 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 and then figure out what you can do to help. So I know that was a lot in a short amount of time, but hopefully that started to help.
Chisholm, I see you had raised your hand first.
Yes, thank you, Dale, for highlighting, that challenge. And I think it's common across ECE programs nationwide. So I would re-echo what Rich said about, trying to assess, their capacity and what they are currently interested in, rather than having them go through the 7 modules of Go NAPSACC. You could, ask them, what is really important to you? What do you think you really want to improve within your ECE program when it comes to the health of your children? Then secondly, I don't know if you've heard about learning collaboratives. People get to tend to enjoy learning when they're doing that in the group. So learning collaborative is a way of pulling people together to learn as a group. Now, the traditional style is probably, the current existing style is probably bringing them in virtually, to do that virtually, but probably you could assess and see if people are interested in doing that in person, maybe once every month, something like that. Every setting, every community is unique, but I think, you should think about the learning collaborative because it has really, really been effective in trying to get people's attention on participating in Go NAPSACC and even other EC interventions. Then thirdly, from my experience working in the community, sometimes people tend to embrace change when it's centered and done. So probably you might want to do marketing around workforce wellness and try and match that with Go NAPSACC, right? So you're targeting the health of the ECE professionals, then have a way of adding in Go NAPSACC around the health of the children. Because you're overwhelmed, but if you put probably maybe just a section of, okay, can we get together to talk about mental health? Then you begin to gather the attention. Okay, if you feel better, you're able to like transmit that, or transfer that down to the kids you're taking care of. But in order for you to do that, you also have to improve your knowledge about best practices. So those are the 3 things that I think, I would encourage, having worked with ECE partners, ECE professionals, and I have tried that and it has helped, that you could consider doing with the professionals in your jurisdiction. Thank you. I would probably log off because my laptop wants to restart. So if I happen to log off, thank you all for inviting me, and I hope to attend some other time when you guys send invite across. But this was very, very informational, and you guys are doing great work. Be very proud of yourself. Thank you.
Thank you. I want to just mention an idea. In the last round of SPAN, we made like a recruitment flyer. If you like, we could see about perhaps updating it with a little bit more current information that maybe could tie in some, hey, this is easy. You could start with small, do it in nuggets, like maybe some ties to the staff wellness. So are you interested in us perhaps trying to update a basic flyer to make it a little bit more current? Maybe give me a thumbs up if that sounds like something you're interested in us pursuing. Just a thought. And I see a thumbs up from Taylor. Thank you. I'd love to see more if you want us to try and go ahead with it. And Taylor, I saw your hand was raised. We have 4 minutes, but I'd love to hear whatever you had to say.
Yeah, thank you. This is really helpful in thinking about how we're going to go about, you know, helping our centers with the Go NAPSACC tool. So I appreciate this. And I was just going to say, as far as like recruiting, I feel like the way that we've had luck in our area recently has been getting invited to help with like self-assessments, because oftentimes they talk about strengths and weaknesses and things that they would like to work on. So I found that through those conversations, that's when I was able to start, you have it written right here. Here, this is what I can, this is what this tool can do to help you reach those goals. So that's how I've had luck lately with TA.
That's useful. I know we're coming to the end of our time. I wanted to propose, I would love, because one goal of this is to give you what you want and need and the peer learning. If you're willing, Taylor, Dale, any others, everyone who spoke up, I would love to have a section of the call next time to hear updates from you on these efforts that you're undertaking, so we can do more learning as we go along. Does that sound okay? We could just open it to the floor, but would love to hear your updates. I see some nods, so that's awesome. Feel free to type in the chat if you have other ideas for future calls that you'd like to hear and topics. We're here to support you. And Dale, I saw you unmuted.
Yeah, I was going to say, I can't seem to get my thumbs up. So I was trying to put a
Okay,
thumbs
great.
up. Yeah, the
We're
flyer
looking.
and
Thanks.
that sounds good. If it works and I can be on, because we are trying a few different things with the Head Start, to kind of get to some of the topics a different way. And then maybe as I work with the centers instead of the main office, center directors might do it, because that's where I started, was with the center, the overall people. And they're trying to do it for 3 centers, and that's not a good way of going. And so, again, staffing's tight. People are overwhelmed. Uh, the grants have changed. In one of my areas, there's also federally funded Head Start and state funded Head Start. So some things have shifted in my area that are kind of new to me, and I'm kind of working on that too. And this is just a percentage of what I do in my overall day job. So, SNAP Ed educators, we have pantries and everything else. So trying to get a handle on that and to figure that out. But yeah, if I can help in any way, that would be great. Mm-hmm.
Great. We'll send a doodle with a couple of times to try and give you all some options and find one that works for everyone. Kira, I know we're in our final minute. Would you like to close this out?
Yeah, absolutely. So I'm just gonna, first of all, I just want to say thank you all for just engaging in such a robust discussion. It's really fantastic to be able to hear from you all, and also for you all to be able to share your ideas and different thoughts. I'm gonna go ahead and I'm skipping ahead because I know we had some other stuff to touch on, but I do want to share. I did receive all of your feedback from different challenges and things that you shared in your last call. And I want to also try to get your feedback on in the future. We want to engage in more TA to be able to attend this call. So I'm just dropping a quick Mentimeter in the chat. You don't have to do it this very second, but if you want to just save that and in your free time, just add in some thoughts on what do you feel like would be great, and a great idea is to be able to engage a wider group of TAs on these calls. We would love to hear that feedback from you all. And then just to wrap it up, I do have some resources I want to share with you, but I'm going to send this out in an email immediately, not immediately, but following this call within the next day or so. So you'll be getting the recording of this call. So if you want to share it with anyone that was unable to attend, also I'll share the slide deck and then any resources and follow-ups that we mentioned in this call. So with that being said, I think we're right here at time. We're just hit right over time. I just thank you all once again for joining us today. We look forward to meeting on a more normal, more consistent basis, and we'll be reaching out to you all regarding the flyer and any other next steps or updates that we have coming up. So stay tuned for that, and thanks again for all of y'all for joining. Have a great afternoon.
Thanks, Kira. Thanks, everyone.
Yes.